Do you want a non-surgical breast lift? Well, PRP, or platelet-rich plasma, combined with PDO threads can give you that lift and volume without undergoing a knife. So I'm going to show you a procedure today, which is the PRP breast lift along with the PDO threads, like I just said, and you can see the entire process. So first well actually not the entire process because I've already drawn her blood. So we draw blood, we spun it down, and we got her platelets really concentrated. It's a special centrifuge that we use that concentrates the platelets 5 to 7 times their normal amount. So we have concentrated them and we put them into our syringes. I have been numbing her chest wall for the past hour and with some topical numbing, and we're going to go ahead and inject the PRP into a few areas so you can see the process. So we're going to go ahead and get started. I've already cleansed the area as well. So here we go. You ready? Okay, 1, 2, 3, little tiny poke. So this is the platelet-rich plasma, and the way this works is that your platelets have biostimulatory proteins that will cause your stem cells to migrate to where they are. So when we do this procedure in the breasts, those stem cells become brand new breast tissue, which is simply adipose cells. When we can also inject under the nipple because the stem cells can become brand new nerve endings as well. You okay? Okay, so number 1 is done. We're going to go platelet-rich plasma injection number 2, just a little higher. 1, 2, 3, here we go again. So you can do PRP in any number of areas. So obviously we're doing them in the breast right now. We can do them we can inject them into the scalp, which causes hair follicles that are suffering and causing thinning hair to really regenerate and causes you to have thicker, longer hair, and can help with the thinning process to help stop that. If you're bald, it's not going to help, but if you have just thinning hair, it's great for women and men. We can inject platelets into the face, and that's called the Prp Face Lift. So it's just like filler, and a lot of times we'll combine it with filler, so we'll inject the filler first. Here we go again. And then as soon as the filler is done, right after we inject the platelets. And so the filler, you see an immediate improvement, and then the platelets, like I said, they'll call to your stem cells migrate to the face, and then they become brand new elastin, brand new collagen, brand new collagen and elastin and skin cells. So as the filler breaks down naturally over the next few months to 2 years, your platelets are making you make new collagen exactly where your filler was. So that's called the vampire face lift. And then there's a vampire facial, which is when we use the PRP and we just put it as a mask on your face and microneedle the platelets in. So sometimes people don't like to get the injections and they just want to have the platelets all over. And so you can just microneedle them in. The microneedling will stimulate the fibroblasts to make new collagen, and the platelets will stimulate your body to restructure. So there's lots of different places we can put platelets, which is great to help restructure your body and skin. Oh, I guess the 2 most important places, we use them in sexual health too. Lean over onto this shoulder a little bit for me so I can have a little access over here. Yep, perfect. Last one over here. 1, 2, 3. Hi. The other places we can inject is into the vaginal area. So if you had stress incontinence, the platelets will call to the stem cells migrate over to the vaginal area, and they'll become brand new pelvic muscle cells. So if you jump and you urinate by accident, we can help that by making brand new pelvic floor muscle cells. We can, it also makes you make brand new blood vessels and nerve endings because all of that is in that area, and therefore it helps with sexual wellness, sensation, orgasms, all of that, lubrication, all of that good stuff. And then the same thing we can do with the platelets for men as well. So if there's any erectile dysfunction or you just want to improve erectile function, we can inject into the penis, and it will regenerate penile tissue, new blood vessels, new nerve endings. So it's great for sensitivity as well as all of the rest. And it can actually increase girth and length as also. So all cool things for platelet-rich plasma. I'm gonna go ahead and inject. 1, 2, 3, here we go, la la la. And they can feel a little spicy. Sometimes people feel a little sore because I've injected them, you know, with the needle a few times. But afterwards, really, there's not any downtime other than the soreness. Maybe you might get a bruise. I always recommend people wear double bras, especially if you're gonna go, you know, do any kind of like anything that's gonna make the girls jiggle. I would wear 2 bras. When we do the PDO threads, I would recommend not starting a new jogging regimen or decide you're gonna start an aerobics class that you've never done before, because I don't want those PDO threads to be moved at all. Okay, so another PRP spot. I'm gonna go right up here, 1, 2, 3, hallelujah, here we are. Okay, and the amount of blood that we draw is less than half of what they take from people when you go donate blood. I like to show our patients as we go along the separation process because I think it's really cool to see. And if you've seen any of my videos, hopefully you've seen the ones where I show you what the process from drawing the blood and separating the red cells from the serum and then getting the platelets at the bottom. So, okay, so now I'm gonna keep on going. One more spot over here, 1, 2, 3, here we are. Excellent work. I'm giving myself accolades. Excellent work. I'm telling my patient she's doing great. And I'm telling myself I'm doing a good job. I did that yesterday. I did a patient's PDO threads and I had to step back and I go, oh my God, I did such a good job. She agreed, thank goodness. But it was funny. Anyway, all right, gotta be proud of ourselves, right? All right, here we go. Well, you're doing great. So this is the platelet-poor plasma. We inject 20 cc's of platelet-rich plasma, and then I inject 40 cc's of platelet-poor plasma. Because if we have all of the extra serum, we might as well use it. It can only benefit us, and there's no real harm in doing that. It's just you have extra fluid in there. You might be a little bit more tender if I injected a little bit more than a little bit less, but you know, if there's an option to improve the results, I'd like to take all of the opportunity to improve the results as much as possible. So results-wise, generally it takes at least a couple months to start to see results. Final results will be in 3 months because it does take that long to make tissue and things like that. Collagen, adipose tissue, I mean, it's not instant. I've got one more injection spot. I'm gonna have you turn onto this shoulder a little bit more so I have a little access more on this side. Yeah. So it's one of those, it's not immediate like a breast augmentation, but it's also doesn't have the pain like an augmentation does too afterwards. You don't have to wear any special garments. You don't have to have any drains. You know, this is really pretty easy. Like I said, the only thing I say is just wear a extra bra, sports bra. I kind of like the idea of those sports bras that clasp in the front because it's a little easier to get on instead of bringing your arms up and irritating yourself. But if you don't have those, it's just really just taking a sec. The soreness can last for 2 or 3 days, but again, the results can start as early as a month, and then it can take as much as 4 or 5 months. So I always recommend people take pictures of themselves every month in the same position. And then I always like to see people back in a couple months as well as 4 months, and we see where we're at with our results. So that's just me. And here we go. Right. So I've already done PRP on our patient's breast to help give her volume and some lift gradually, but she wants lift right now. So we are going to add some PDO or polydioxanone threads into her breasts and pull them up. I have already put some numbing. There's lidocaine right where I had that little needle. And we're gonna go in. I made a little channel as well. And I'm gonna go in right through my channel. And we're gonna push. And it's just gonna kind of feel funky. Funky, funky, funky. All right, here we go, going all the way down. There we are, you okay?
Mm-hmm.
Excellent. All right. And there we go. And there's our first ones in. Excellent work. Maybe we'll just make another little spot right next to it. Can you feel that?
No.
Okay, so sometimes we need to make a couple ports. We'll go there, see if that, now that, yeah. Okay, here we go. Down, 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 awesome. Go down as low as possible. And I'm gonna twist and come up. Perfect, okay. Now we're gonna keep on going. I know, this is fun time. So this is made of the same material that surgeons use, especially in cardiothoracic surgery. So people have typically had experience, so I haven't seen any allergic reactions with this. These kind of threads. So that's nice. And they are a bit antimicrobial, so they tend not to get, or they don't typically get infected. Now, with that being said, I wouldn't advocate you going swimming tomorrow in like a pond or, you know, even a swimming pool. I would let these little channels heal up, which just takes a day or two. Okay, they're not, doesn't want to share there either, so let's go just a little bit farther over. Can you feel here?
Mm-hmm.
Okay, good. This is what I do, multiple little, or a bigger spot, I guess, with the lidocaine. There we go. All right, there we are. Okay. These threads are being persnickety today. Here we go, all the way down. So these threads are going to dissolve over somewhere between even 6 months up to 2 years. So it just really depends on how quickly you metabolize these. They don't need to be taken out. They will just dissolve on their own. There's no problems with doing mammograms with these in. They shouldn't be seen on a mammogram at all. I always like to tell the people when I'm getting my mammograms what I've done, and they're always like, what? You did what? And then it starts a conversation, and it's kind of fun. Anyway, because I've done not PDO threads for my breast, but I've done the PRP, and I just love it. Anyhow, okay. One more. And, are you okay? I know, a little tight there. All done. There, I'm out. I'm coming out. There we go. All done. This is what's going to happen with her breast, right? So I'm just going to rub. And so after the PDO threads, people can be a little sore because they're a blunt tip, and that's why you're feeling it as I'm going through, because the thread is loaded onto a blunt tip cannula. So we just have to kind of find our path through the skin, and just, there is a little pathway that things can go through. So so the blunt tip, I'll show you, this is the blunt tip right there, and it's not poking me because it's a blunt tip. So that leads to a lot less bruising, but it can be a little uncomfortable because I'm just pushing through, but she's a champ here. Okay, so let's just, and this is how I'm just gonna get rid of these little ends here. There we go. And let's take these, get rid of these ends. And one more. And these are, it's similar with the PRP. I always recommend double brawling. Don't lay directly on your breast for the next couple of days. You'll not feel like it anyway, just because it'll be a little bit sore because of all of this. But and then don't decide you're going to go for a jog or do an aerobics class, things like that, for the next few days, because you're just going to want these to stay in their place. But you can see how that brought her breast up, and this one's still down a little bit. So we're going to stop the video. We're going to transfer over to this side, and then we'll be back in a sec. So I have my lidocaine right here so she doesn't feel the channel that I've just made to allow my blunt tip thread to go through, and we're just gonna push our way down. I know it looks a little kamikaze, but it's actually a good thing, because as the blunt tip goes through the skin, it irritates the fibroblasts, and we like to irritate them because then it'll make them make new collagen. So just the process of doing this helps you make new collagen. Well, I like that. Anything to make new collagen. That's the whole name of this anti-aging game. Ooh, okay, she did not like that one. Let's go up a little bit. Oh, she doesn't care for this spot. That's okay. Sometimes you can get a little spicy. We're gonna just, let's push our way through, and I'm coming out. I'm out.
Sorry.
I'm out. It's okay. Sometimes it can be, it's okay, it's real life, right? So we're gonna just go to another spot so I don't have to irritate you again in that spot. Can you feel that?
A little bit, but.
How about here?
No.
No, okay, we'll go down a little bit further. There we go. Yeah, some of these can be a little, they get along a little nerve, they can be mean. Okay, that's to make a channel to allow the thread to go through. Okay, let's go here. Lateral now. Here we go. That one was much better. Yeah. Okay. Here we go. Coming on out. Beautiful. Great. Another one. And that spot. I swear this procedure really is all about the prep for it and drawing the blood and all that. This part actually doesn't take too long. If you do decide to come for this procedure, make sure you hydrate well beforehand and let us know how good your pains are. We do like to have a little heads up. Okay, a couple more. How you doing? Okay?
Mm-hmm.
Okay. That's not entry. Okay. And PDO threads have been around a long time. Like I said, surgeons have used them for years and years in the OR. Okay, little push. Little guy, just one more little. You're gonna come out right there. Doesn't really want us to go. Okay, here we go. Go one more towards the middle. Okay. Last one here. Oh, look at you. Look at you being all good. Awesome. All right, you did great. So now I'm going to do the same thing like I did on the other side. Ooh, look at how pretty that's going to be. I love that. Okay. Especially with the pasty flowers on your nipples. You can even go home with those. All right. You know, sometimes the different social medias don't want to see nipples, so that's why I got these little pasties. It was too hard to cover them up when I was doing the procedure, so that was a great idea. Anyway, okay, so I mean, really, you can see what that difference that made already. I just love it. But again, her main difference. So I didn't tell you really about how the PDOs work. I mean, they give you an instant lift, but they also have some instant swelling. So as your body surrounds the threads, it's going to make new collagen around the threads in this upright position. So yeah, I always say threads are a gift that keep on giving. And usually people like to do these, you know, it depends on how much lift you get. You might need more threads or maybe less threads than your neighbor, depending on the size of your breast and how much you want to lift. And I don't know if you're talking about this with your neighbors, but whatever. Best friends, worst friends. So, you know, we did 6 per side. Some people do 3 per side. Some people do, you know, 10 per side. So it really just depends on what your goals are and how much lift you want to get. But again, she won't have, I mean, this is going to be her downtime. There's 3 little holes on each side. So I think it looks great. It's going to heal nicely. She'll wear double bras. She won't push on her breast. She won't jiggle the girls as much as she can for the next week or so. She's not going to feel like jiggling them. So your belly dancing days for now are on hold. And then the threads themselves, again, immediate lift. And then your body is going to surround them with tissue, and then it's going to stimulate you to make your own collagen. in this upright position. So threads are a great alternative to surgery. I can't predict the lift that I'm going to be able to give you, but the more threads, the more lift. So if you know for sure you want to be a size double D and you want your breasts to your chin, this is not for you. Go to the surgeon and have them do what they do. But if you just want a little lift, a little volume, you just want to not have to go through all of that, try this out. It's easy. I mean, you saw it. We just had one thread that was an issue, but I mean, relatively easy considering the results that we're going to get.